Welcome back to Good Day State Line. We are at MD Skin Center with Dr. Stenstrom. Good morning.
Good morning.
So we are really excited to be here. You know, it is International Women's Month. You're a woman who has an incredible job, and I assume a lot of your clients are also women, and you're helping them live their best life?
A lot of them.
A lot of them?
We see a lot of men also.
Perfect.
Yeah.
So tell us a little bit about you and how you got started in this field.
So I fell in love with dermatology as a fourth-year medical student, and then once I did my residency at University of Wisconsin, I ended up in Rockford. I joined a big health system as the only dermatologist for that health system. And then after about 4 years, kind of thought that there was maybe a need for a larger, comprehensive derm facility in Rockford.
And so that's where we are now.
And that's where we are now.
So tell us what happens here at MD Skin Center.
A lot, actually. So we really are a full spectrum comprehensive derm clinic. It is co-owned by myself, so I'm a board certified dermatologist, and my partner, Dr. Andrew Junn, and he is a board certified head and neck facial plastic surgeon.
Oh, cool.
Yeah, so it's really a unique combination that allows us to really serve skin cancer patients very, very well. So we can detect and treat almost every skin cancer, specifically high-risk areas. He's able to do those reconstructions right here in the clinic so that most patients don't really need to go to other areas or other clinics to have all that done.
That's super important.
Yeah.
You know, when you first think of dermatology, you obviously think skin, if you can figure out,
Yep.
words, derm is skin. But you always think face, but it's everything, right?
It's everything. So we see babies, teens, elderly. We have a pretty even population of both men and women. So it's the whole gamut, and that's part of what I love about it is the variety of what we do. We do full service medical dermatology, but we also do cosmetic dermatology. So we have cosmetic services, everything from fillers and injectables to lasers and other treatments as well.
So you said you see, any human being who could possibly
Pretty much,
need
yeah.
your services.
I think my oldest patient was maybe 106.
Oh,
that's
gotta be a dermatologist record.
Yeah, and I see newborns. So
that's really, really cool. And there's so many different services that you provide. I assume from someone who is struggling with acne to someone who has rosacea, who maybe just has a random rash or something, right?
Oh yeah, that's the best. The rashes and detection and being able to figure out what that rash is, that's one of my favorite things to do is the unknown and figuring that out. But yeah, with the full spectrum of what we do, if somebody were to have their skin cancer removed and then need some revision of that scar or some treatment to that scar, we really can pretty much provide everything, including products, skin products that they might want to incorporate into their anti-aging routine or just sun protection after they've had a skin cancer. So everything can be done here.
Yeah, it's pretty cool. We walk right in, and it was I was like, oh, are we at the gift shop?
Yeah.
That's how I felt when I walked in. That's a pretty awesome feeling to have when you walk into a medical facility that not everyone is always comfortable. They get nervous when they have to have any sort of checkup, but it's a very inviting, comfortable environment, and then there's beauty products to just look at, and you have a ton of them.
Yeah, we wanted it to feel very soothing and just to kind of be a little bit more of a homey atmosphere rather than a sterile medical clinic. So we put some effort into that.
I love that, especially when you have all these products too. I'm guessing you and your entire staff can help tell people how to use them and what they actually should be using instead of when you just go to the store oh, this is pretty.
Exactly. Yeah, if you know their skin type, so we are able to assess their actual skin type and maybe the best products that would be right for them rather than them just picking the pretty bottle at the store.
Sometimes the pretty ones are the most expensive and you don't even need them.
They're the wrong one, yeah.
So tell me, since we are celebrating International Women's Day, just how it feels to be such a successful woman in the medical field, which predominantly men are, usually leading the way.
Yeah. Well, I had a very supportive family. My nuclear family growing up was really supportive of my goals, and now my current family is very supportive, so that takes a lot. I mean, my husband and I lived apart for 5 years before we got to live in the same state, so you do go through a bit of a trek when you're a female. I had some really good mentors, both in medical school and in residency, that were able to kind of show me how you could do a successful practice, a medical practice, and have a life outside of that as well. And now I have 2 girls.
So. Oh, cool. So you can pass on the sisterhood of being awesome as a woman to them.
Yeah.
For anyone who wants to come visit you and has any questions, where should we go? check you out?
So we have our website, which is mdskinrockford.com, and then we have our Facebook and Instagram sites. And so if you just search MD Skin Center, and they'll be popping up for you.
And physically, where are we located? Because I'm really bad at geography, so I should just ask how I got here.
So the Cornerstone building on the corner of Mulford and Guilford. So big red brick building on the 2nd floor.
Coming up next on Good Day State Line, we're chatting with Tanya from Collins Aerospace, and later Emily Valvra is joining us from Hollywood to talk about this year's International Women's Day theme. We love to chat with you every chance we can get, including at mystateline.com/GDS. So last week we asked you, what's your favorite kind of flowers? It was not a close call at all. Some flowers took the lead on this one right off the bat. This week we're asking you, what's your favorite Girl Scout cookie? Thin Mints, Caramel Delights, or peanut butter patties? Let us know now. Vote at mystateline.com/GDS. We'll be right back.